I would request though that you mute the microphones once you've activated them, because otherwise we get a fair amount of distortion on the line there. And obviously we've got the chat box here below as well, which anyone can, put questions, reflections in there, and we'll probably kind of post and prompt questions as we run through as well. So just briefly in terms of the agenda, I'm not going to go through all of this here, but you can see what we'll cover today. Start with some framing questions, and then Isabel Pelly will provide an introduction to the framework, which will look at the background and rationale and an overview of the tools. We'll then get some reflections from two consultants who had worked with CALP to develop and apply the framework, so they'll be looking at how they've used it in practice and their experience and lessons learned. So we'll get kind of more general overview and reflections from Kristen Smart, and then looking specifically at the Greece Cash Alliance case study will be Robin Lataf. We'll then open the floor for a round of questions, clarifications on what had been presented up to that stage. Then we'll go briefly to look at some of the ideas that we've had internally, looking at next steps, how to further develop the framework and opportunities for engaging with the wider community of practice. And then looking beyond that, obviously, the participants here and their reflections, kind of upcoming initiatives that they may have, that you may have, and opportunities for collaboration there. So just wanted to begin with a couple of framing questions that it would be obviously useful for you to keep in mind as we go through the presentations, that might inform questions that you want to ask yourselves as we go through. So what are the key questions and information needs that you have in your role and your organisation with regards to operational models? And that might be obviously thinking about how you might need to use certain sorts of information. Like, is that to be able to inform decision making about how to choose and design a suitable operational model? Are you someone that's looking at this in terms of how to best generate evidence and the types of tools and frameworks that you might use there? Are you looking at the kind of evidence and information that you would need to be able to inform advocacy? So there's obviously various ways in which you might need to glean information about how operational models for CTP are working. And then obviously coming back to the framework that we'll be presenting today, asking like, can this framework and the learning generated play a role in helping to address the questions and information needs that you have? And and then if not, or if to an extent yes, but what else would you need in this regard? Are there other tools? Are there adaptations that would be needed? So it'd be great if you can keep those things in mind as we go through. And please, if you've got any questions, put those into the chat box, and we'll do our best to get through those. If we're going to try and obviously do this within the scheduled hour, but if we find once we get to also 2 p.m. UK and there's still a lot of questions or discussion, then we can run on for another sort of 10 to 15 minutes. Okay, so I'm going to now pass to Isabel, who will take us through kind of how the framework came to be, essentially, and the tools that are involved in it.
Thank you, Ruth, and great to see so many of you online, and looking forward to a fruitful discussion. So we first started thinking about this work towards the end of 2016, actually when CALP was strengthening its work as part of the Save the Children-led ECHO-funded ERC consortium, which was all about how to collaborate better on multipurpose grants. And we realized that there were a lot of assumptions that were being made around the link between different forms of collaboration and particularly increased efficiency and effectiveness. And that the idea that greater collaboration led to greater efficiency and effectiveness. And Kristen in a while will take us through kind of how this thinking informed different phases of the development of the framework, but that was really sort of a starting point for CALP. And as many of us are aware, I think those sorts of assumptions then got translated into a lot of policy positioning by either various operational agencies or donors with regards to what they wanted to see, particularly in large-scale CTP, and what the role of different actors would be really in taking CTP to scale, and again, particularly MPGs. And this conversation, as many of us are aware, was getting rapidly politicized and at times quite challenging, I think, between, and there was a disconnect to an extent between sort of certain policy positions and operational realities, and a challenge in sort of navigating through that in practice. And so, working with CALP's technical advisory group and then with an operational models working group as a subset of the TAG, we really tried to get our heads around this question. And it's been a tricky journey, and it's still a journey that we're on. So that's why this is really a conversation rather than just a sort of presentation. So firstly, we started to think, well, what are the different types of, let's call them operational models for delivering CTP at scale? What we realized is that the idea of one agency doing everything is becoming less and less common and less appropriate, and actually that there are many different forms of collaboration that have been tried and tested over the last few years, and that may be appropriate in different contexts. And we decided to use the terminology operational models for cash transfer programming. And the definition that you can see there at the top of the slide is the language that we used to describe what we mean by an operational models for cash transfer programming. And as you can see, this spans the whole program cycle. So we're really not just looking at the delivery part, but also situation response analysis, design, implementation, and monitoring as well. And recognizing that collaboration is required at all stages, really. And the types of operational model that are listed here on this slide are just a little snapshot of the different setups that we've identified in different contexts. And this comes straight from CALP's State of the World's Cash report, which has a really rich section in chapter 6, all about the rationale for the development of different models and the emerging evidence base as well. So I'm not going to go through each of these different types of models, but as you can see that they're actually quite different. I mean, some of them is really about, okay, are we talking about having a single agency for delivery, and this has been a sort of big part of the discussion, has been a fundamental part of ECHO's guidance on large-scale cash transfers, for example. Or are we talking about shared delivery mechanisms, which is more the model that the Common Cash Facility in Jordan has trialed. And then, irrespective of how the delivery is being done, is there a structure of a consortium or an alliance that allows us, or is that necessary, and can it be a much more loose form of collaboration but still with shared delivery mechanisms? So these are all a number of questions to take into this discussion. Is sort of how formal does the level of collaboration have to be, and then how streamlined does the delivery of each different function have to be? So it's a lot of questions, and as I alluded to, these questions were playing out in reality in a number of different contexts, and that's why we thought, okay, let's sort of bring some evidence back into the discussion and help both donors and operational agencies make decisions based on that common understanding of evidence. So in order to build that evidence base, we thought, well, what's our starting point? And then we could have had a number of different starting points. We sort of said, what does the literature say about what drives efficient and effective operational models for any type of humanitarian response? And let's kind of extrapolate that specifically to cash transfer programming. And maybe that might be a sort of next phase of this work. But what we decided to do is to look at well, what is it that we want to collectively achieve in terms of quality, large-scale cash transfer programs, and particularly multi-purpose grants? And by starting by what does quality look like, that would sort of move away from a focus on one model being better than the other. And so the different determinants of quality that we looked at are efficiency, effectiveness, but also crucially accountability, because what we observed was a risk for, particularly with a strong drive towards efficiency, cost efficiency, for some of the accountability questions to be neglected. And so as you'll see when I go through the framework, the accountability is as central to the framework as efficiency and effectiveness. And the questions we're seeking to answer with this research agenda, its learning agenda overall, were, so to what extent are different models efficient, effective, and accountable, and why? Also recognizing that these operational models for cash transfer programming don't exist in isolation of a broader humanitarian response, and that in really most cases, cash needs to be complemented with other interventions. So how does the operational model relate to other interventions and to other processes within the response as well? Then what is context specific about the way in which that model has influenced the quality of CTP? And based on all of that, what does this mean for replicability of the whole model or of certain aspects of the model? So those are some of the driving questions that then led us to developing the framework. So what I'm going to present to you right now is how the framework looks as it is, and a couple of examples of the type of analysis that it can generate. And then Christian's presentation will give a bit more background on the different phases of the development of the framework and the type of evidence we generated at each phase. And then, as Ruth said, Robin will take us through what using the current framework looks like in practice. So we've now rationalized the framework to 3 tools, basically. And so just to reiterate, this framework in its current form is used to generate evidence on different operational models in order to answer those questions that I just alluded to. So there is no absolute baseline for what good quality, large-scale cash transfer programs look like. And I think that's also a realization that we've collectively come to over the last sort of year or so, and even in the latest iteration of ECHO's guidance, there's more nuance, for example, on what they want to see in terms of the total cost to transfer ratio, for example. Recognizing that there isn't a sort of absolute that we can be aspiring to. But the more that we build an evidence base on what works well in different contexts, the more that can serve as a basis for comparison. And again, that's something that Christian will touch on later. So, so the 3 tools that the framework is currently comprised of include one which is a sort of a general overview of the background of the operational model. So first of all, in terms of the context, but also in terms of how it was structured or how it is structured. So who's involved? What were the drivers that pushed for it to be structured as it were? Was it quite donor driven? Was it based on collaboration in other contexts being replicated in a new one? How does it work? Who's responsible for what, etc. And that's also really useful background just to recognize often that these models don't emerge always in a very sort of structured, logical way, but are often a factor of a number of different circumstances. And that can be positive in some senses, but not always. Then the second tool, which is really the crux of the framework, actually includes a number of different elements. And what the objective of this part of the framework is really to map out what aspects and actions of the operational model have a positive or negative impact on quality. And effectively, we've split that into 4 different parts. So the first is the project cycle and the operational model. So as I mentioned before, our definition of the operational model looks not just at the delivery part, but at all different stages of the project cycle. So recognizing that there can be huge gains in terms of efficiency, effectiveness, and accountability, for example, just at the situation analysis and response analysis stages, even if delivery is carried out through a number of different mechanisms, say. And so what this section does is looks at what is it about how the operational model works for each stage of the program cycle that drives greater efficiency, effectiveness, or accountability. And I'll show you what that analysis can look like in practice in a second. The second part looks at what are the drivers of efficiency, effectiveness, and accountability, either that are specific to that context or that are specific about the model, which have been particularly influential. So again, I'll show you some examples of what those drivers can be. But in order to track that, what we've provided is a list of suggested drivers, but these can be different by context, and then also a list of indicators that are linked to each driver that can allow you to measure the extent of the influence of that driver and to contribute to this overall evidence base. The third area in this second part of the framework is looking at the total cost to total transfer ratio. So this is really the cost efficiency part, and is theoretically the most comparable across contexts. And there's some really useful work being done by IRC and USAID as part of the Grand Bargain Cash Workstream that is contributing to how we measure this more systematically. But there's some strong guidance in the framework already on this. And finally, the model looks at, the framework looks at what was the influence of how the operational model is structured and how it works on the broader response. So recognizing that those influences can be both positive and negative. So how did it incorporate and maximize broader aspects of the response? So there's a lot in that second part. And then finally, the third part of the framework is a stakeholder survey, which really looks at outside of the operational model, the different, upwards and downwards accountability, really, from the people who've been engaging with it as a platform. What's the perception? And that helps, again, elevate the discussion out of the model itself and look at the broader response. So that's a lot to digest. The framework is online, as Ruth has just shared. But I just wanted to show you a little bit more detail about what this can look like in practice. So, as I mentioned before, one of the ways in which we analyze information on the models is by looking at drivers of quality, so particularly drivers of efficiency and drivers of effectiveness, and looking at how the model influenced these. So this is just a snapshot of some example drivers that we have in the framework, but I think what's really important about these is that we didn't pluck them out of thin air, but they came from the existing evidence base. So we know for a fact that these things can influence quality in a positive way. Now, to what extent and how we measure the extent to which they've influenced quality will depend on context, and that's why it's not a standard set of drivers to be analyzed in every case, but rather part of the methodology of analysis is to say, well, which of these drivers were most relevant for this particular study. And now, sorry, this is a little bit blurry, but this is just an example of what that can look like in practice. So if you look on the left-hand side there, this is from the Greece Cash Alliance study. There's a list in the sort of first column, a list of the drivers that were picked out for the Greece study as being particularly relevant to how the operational model influenced quality. So there's a selection of them there. And then the color-coded table is an indication of to what extent those drivers influence quality in a positive or negative sense, and that's indicated by the color coding, and then some contextual factors on the side. So if you can imagine what that would look like across a number of different studies, if you look, for example, at governance structure, which is just the second one there, if you had evidence on governance structure and how that influenced quality in a positive or negative sense across a number of different studies, that can inform decision making on the type of governance structure that is appropriate to drive greater gains in efficiency, effectiveness, and accountability. This is a second just example of how the analysis can look in a finalized report. So this is looking this time at the project cycle. And so here you can see each stage of the project cycle, and this is just a snapshot. I mean, this continues for the other stages. This time this is from the Nigeria case study, and just indicates to what extent, well, what the level of influence of the consortium has been on that particular stage of the project cycle. And that's a good way to sort of evaluate its effectiveness as well. If it was really meant to have a significant influence on monitoring, for example, but didn't, then why is that, and what can be learned for the future? I'm going to stop there, but I hope that gives you a bit of a snapshot of how the framework is structured and the type of analysis it can generate. And now Kristen's going to go into a bit more depth on the background and the learning that we've already generated today. Thanks.
Hi, everyone. Thanks, Isabel, for providing that overview of the framework and the different ways that could look like in different cases we've done so far. I'll just talk a little bit about the use of the framework in practice. So as Isabel mentioned, it was quite a difficult process to try to come up with a framework that was able to capture operational learning around the use of a framework, but also feed into sort of global discussions around operational models and the use of models at scale, and that could somehow capture the element of context and personalities involved in the formation of operational models at the ground level. So recognizing that it's taken 4 different versions, the presentation I have is just to kind of talk through the use in the different versions of the framework that we've had so far. So there was a sort of first version of the framework which looked at interagency collaboration as an operational model, and that had 4 case studies included, Iraq, Afghanistan, Philippines, and Ukraine. And that study started to unpack the idea that greater collaboration had a direct impact on greater cost effectiveness across the delivery of cash transfer programming. And the reason we chose those 4 case studies was that they had quite a wide variation in the levels of collaboration between the different member agencies of those different models. So for example, in the Philippines, it was an extremely collaborative and proactive, let's say, cash working group, which played a role very similar to what a consortium model might play in another context. And then on the other side, let's say we had Iraq, which was a highly formalized consortium model. So it sort of allowed us to unpack what collaboration looks like in different forms and different shapes, and what that means in terms of perceptions on the impact of effectiveness overall. From that version of the framework, we were able to generate some learning that allowed us to focus in a little bit more on the operational models aspect. And then we looked at that through a study in Jordan, as Isabel mentioned, of the Common Cash Facility. And we were trying to, in this case, think about how we could use the framework to unpack a bit more the role of the model itself on efficiency, effectiveness, and accountability, which was a step further than just looking at collaboration, which had been sort of the focus of the first version. And then in the third version, which we started working on last year and involved quite a number of stakeholders, as Isabel mentioned, through the technical advisory group for this project, we were able to break down the framework into a number of subsections, which Isabel just spoke through, with the aim of really unpacking what we are talking about in terms of operational models and how we could capture the role of the model, both in terms of the delivery of assistance, but also in other aspects, for example, on influencing the broader humanitarian response, perceptions of stakeholders, if we could use, for example, more quantitative data. So with this third version, I think we've come quite a long way in what we're able to capture. in a fairly simplistic approach compared to previous versions along the way. And we're able to really look at the question of how do operational models contribute to efficiency, effectiveness, and accountability. So we're able to sort of pull out a little bit more the role of the model itself and the structure and the objectives in those particular quality areas. The framework itself was used in the first, I'm sorry, just going to speak through a little bit of the ways that you can use the framework so that I can be clear about its potentials. The first version was done through just a desk review and consultations with people who were involved with the model, so it was kind of a very minimal approach. The second version was done again with a consultant team, but it was also combined with a broader study, which was led, I think, by UNHCR and also CALP. And that was a desk review, a field visit, and focus group discussions and key informant interviews. And the most recent version of the framework we used both through a study directed mostly around the framework, that was in Greece, and then the study in Nigeria also included additional study objectives that were part of the operational model there. And that was applied, again, through a desk review, a field visit, key informant interviews, focus group discussions, and follow-up after that. From all of these, we've been able to generate some learning and findings, and that this is, just to highlight, this is an ongoing process, and not only with the changes to the framework as we try to make it more adaptable and more flexible to meet the different needs and also to capture a wider range of information, the findings themselves are really preliminary, and we've just started to look at all these cases holistically and say, what does this tell us about operational models, and what does this tell us about context and the role that plays in determining the areas of influence of an operational model in terms of efficiency, effectiveness, and accountability. So this is by no means all the findings in the studies. I just wanted to highlight some interesting pieces that have come out that might be of interest to those on those call when they're thinking about, okay, what if I use this framework, or if I were looking at this framework, what does it have the potential to tell us about operational models? And really to frame this learning in the broader question for this webinar, which is around, okay, once we identify some learning from all these studies on models, what do we want that to look like in terms of an evidence base, and how can that be most effectively structured and contribute to broader discussions on operational models, which are useful for different audiences. So what does that look like, at the global level in terms of advocacy, but also what's most useful at the country level in terms of helping agencies determine what types of models that are most appropriate and feasible in their context. So yeah, just to say that all of this is contributing to something that should be packaged in a way that's very user-friendly to different audiences, and I think a great point of this webinar would be to get your feedback on what that should look like. So, for example, in Iraq, there was the key findings around cost efficiency were that high cost of the collaboration at the onset in terms of structure and setup and harmonizing were balanced out over time, and that was actually a key finding across quite a few of the studies, which I will come to a bit later. And then we also saw both in Iraq and in Nigeria, and I think in one or two of the other cases, that the highly formalized models, the consortium models, played a strong role in influencing cash discussions outside of the consortium. So there is a role for these kinds of models in advocating for or leading cash conversations outside of the models themselves. Another finding, again, it will be mentioned on the next slide, across the studies was that there's a strong relationship between effectiveness and harmonized approaches. And in the case of Iraq, that also included the ability of agencies to refer cases between each other. In Ukraine, there was a very similar finding around cost efficiency, that collaboration in itself is quite costly, and unless the program is running for long enough to see some of the benefits of spending the time and the resources on harmonized approaches, on harmonized data sets, on systems to reduce duplications of caseloads, for example, that it may not be worth the initial large investment in the front of an operational model. There was also recognition in quite a few of the case studies, which was also highlighted in Ukraine, that there has to be a connection between what the operational model looks like on paper and how the agencies interact in real life. So I think in Ukraine and also in the ERC studies in Nigeria and Ethiopia, that learning was kind of recognized by the fact that It's one thing to have a functioning model on one level on paper or at the global level, but then to make sure that that functionality is replicated with the key actors at the interagency level on the actual delivery side or the operational side is also just as critical. In the Philippines, it was a very interesting study for us because it was a cash working group, and they had some of the same gains in effectiveness that you might see in a consortium. And some of the reasons for that was that it was a highly structured cash working group. The context itself was extremely conducive for cash transfer programs. But also they were able to agree on harmonized approaches and standardized cash transfer programming, which again is a strong contributor to effectiveness. And they were able to do that without the highly formalized collaborative model. In Afghanistan, there was, I think, a strong point of learning, which also came out in a number of the studies, that even if something is less efficient or less effective, let's say, in the scale or operational model considerations of large-scale responses for cash, they can have other benefits, such as flexibility of response. So in Afghanistan, working with lots of NGOs in harder to access and harder to reach areas, might not have supported cost efficiency gains, but they were definitely supportive in allowing for a flexible response in which other gains could be reached in effectiveness and accountability. So I think, again, this learning highlights that the framework can help you look at cases in a way which balances the efficiency gains and effectiveness gains and accountability gains, and look at that holistically. So you're not just focusing on cost efficiency or effectiveness alone in your analysis. In Jordan, again, it was some of the similar learning. What was quite unique in the Jordan case is that the agencies involved could run with their separate cash transfer programs, but using one delivery mechanism, one financial service provider, which was facilitated through UNHCR. So there was gains in terms of efficiency and accountability, I think, with communication on the beneficiary side, but then again, in effectiveness, it was a bit limited by potential gains in effectiveness, let's say, could have been limited by the fact that they were all running still very separate programs. I'll let Robin, who's presenting next, and he led the Greece study, talk through Greece a bit more. And then the last study that has been done using this framework, or this version of the framework, was a look at the Enhanced Response Capacity Consortium, which ran 2 pilots in Nigeria and Ethiopia. And those pilots are not based on an implementation of a cash program, but a very technical focus on getting tools and systems and enabling an environment in place to facilitate the use of cash in different contexts. So this model was quite unique because the structure was specific to the objective, which was very light and global focused, and it allowed for gains in cost efficiency. So when you look at what the ERC consortium was able to produce, they produced some very strong technical tools, and the model was well designed to produce those technical tools. But at the same time, as I mentioned in some of the other cases, it wasn't matched by, let's say, the interagency buy-in at the country level. So it highlights the importance of all the key players in an operational model being kind of on the same page and having the same interest in engaging in order to positively influence efficiency, effectiveness, and accountability. Some of the findings that we can, again, these are very preliminary, and I think we're now, and CALP is just now starting to look at this holistically and saying, what general learning can we bring from this? As I mentioned already, some of those are around the fact that, as you would expect, collaboration is expensive and costly in terms of time and resources, especially at the onset, and then that really needs to have its time to come into play where you begin to see gains in terms of efficiency and effectiveness. What was interesting as well is that there was a relationship between collaborative operational models and cash coordination. So sometimes cash coordination might play a role similar to a large-scale operational model, like in the Philippines, for example. Or in the other cases, a very highly collaborative model might play some of the roles of a coordination model, which I think it was the case in Greece. It was kind of the next step in cash coordination, as in, well, in Iraq, it played a strong role in influencing the coordination system in Iraq. Of course, which you would also have expected to see as a key finding, is that the contextual needs and the specific feasibility of cash programming in each country plays a critical role in the design of the model and its potential gains in efficiency and effectiveness. So as I mentioned, in Afghanistan, the model was well designed to deal with the remote context. As Robin will probably mention, in Greece, it was well designed to deal with the mobile population of refugees. And in Jordan, it was uniquely placed to deal with the potential to use one financial service provider and one delivery platform. So, and that was a refugee caseload, so again, a little bit more manageable under one delivery platform. Another key finding that I was kind of happy to see across the studies is that all these operational models play a strong role in influencing the broader response in terms of cash transferring programming. And the stronger the model and the collaboration between the agencies, the greater potential to advocate outside of the model itself for cash conversations. And that includes pushing for harmonized tools and approaches, both within the partners in the model and externally in a lot of cases. Of course, as you would also expect, we found that in the models, the level of success is influenced both by the reasons for formation. So in some cases, the models came organically out of the context. In some cases, they were a bit more donor-driven or driven by other factors, as well as the personalities of those involved. So the level of incentive for engagement, let's say, for different actors in the model. And what was also kind of surprising is that I think we have some assumptions that around the large-scale operational models and using one FSP and one delivery platform as automatically being more cost-efficient, which hasn't necessarily been the case in the studies that we looked at. Thank you. In the studies that we looked like that include one shared financial service provider or one shared delivery model. So is that my screen doing that? Thanks. And then Robin will talk through this a little bit more as well, but in terms of challenges in the use of the framework across these studies that we just mentioned, it's quite difficult to get the amount of data and information you might want from all the agencies involved in a model, including ideally monitoring and cost data. And the more and more we are trying to look at quantitative indicators, the more difficult that gets. So I think we recognize that the findings are only as good as the data we have, and that has been a challenge across the project, across the use of this framework. As I mentioned, the quantitative data. It's quite a lengthy framework, and it requires a strong commitment from agencies, but that being said, it's also quite flexible and adaptable, so it's not something that needs to be used in whole in each case. And I think one of the key difficulties is that it's hard to separate the role of context and its influence on efficiency, effectiveness, and accountability from the role of the operational model in influencing efficiency, effectiveness, and accountability. And that doesn't necessarily have to be in conflict. Maybe that's okay that we can't separate that learning, but it is also quite difficult in many cases to attribute, okay, what about the model itself had this specific aspect? And if it was something outside of the model that also influenced, what's the relationship between the model structure and that outside influence that allowed for these gains or losses in efficiency, effectiveness, and accountability. So to highlight on this, that I think what we've realized through the use of all these different case studies and the use of the framework is that it is flexible and adaptable. As I mentioned, in a few of the cases, it was combined into another ongoing study, so it wasn't the standalone use of the framework, but pieces of that were able to inform the study that was already ongoing or planned under another review. The areas of the framework itself can generate specific learning. So for example, as Isabel mentioned, it's separated in context, project cycle, drivers of efficiency, effectiveness, accountability, total cost to transfer ratio, stakeholder perceptions. All these pieces can contribute to standardized learning around specific areas. It also provide us an opportunity to start mapping out where some similarities are and differences. As I said, that relates to the broader learning and another discussion point around what that learning should look like and contribute to going forward. As I mentioned, I think there's a strong case in the use of the framework for bringing back conversations on effectiveness and accountability to a conversation that's often focused on efficiency. And the framework allows for you to kind of counterbalance those things. Again, it requires data and information to be shared to be able to do that analysis. But in theory, you can kind of weigh, okay, we had maybe a loss in efficiency, but we had a gain in effectiveness and accountability, which is where we should kind of be focused anyway. So it allows you to have that kind of a conversation. And it also provides a strong way of looking at different costs involved with the operational models, which I think is a useful way to break down when we're talking about cost efficiency. So that's it on my side. I can't see the chat box anymore, but I'll try to open it in a second in case there's any questions. And I will hand over to Robin, who led this study in Greece and also supported studies under the first version of this framework.
Hi everyone, and thanks very much, Kristen, and others for the introduction. So the idea is just for sort of 5 minutes to talk you through practically what it meant to pilot this framework in Greece. So Greece was the first time we used this third version of the framework for an operational model between October and December. The Greece Cash Alliance was launched in April under UNHCR lead with a cash response fully funded by ECHO and 5 international partners. They reached over 36,000 asylum seekers or refugees by the time of the review, so it was definitely at scale, aiming to reach every person of concern in Greece. What's interesting is that the review happened at a time when the model was evolving. So the Cash Alliance in its iteration that was reviewed was involving these 6 agencies and had been based on a joint application to ECHO by the different partners. And it was clear that was necessary for that phase of the response, which was focused on harmonizing the cash response and getting everyone to use the same tools, transfer amounts, targeting. But then moving forward in 2018, it was also clear that the number of partners involved was maybe not necessary. The mobility of the population had changed with some of the political developments around the migrant crisis. And so the model itself was going to change in 2018, which is why this was quite a timely review, and hopefully some of the findings were used in the evolution. So we did 3 phases of data collection in line with the framework itself. First we did basically a desk review, trying to interview key stakeholders involved in the formation of the GCA, the Greece Cash Alliance. Through this, we identified the drivers that Isabel and Kristen referred to earlier. So the areas that we think, given the context and given the model, we want to focus on to look at impact on efficiency, effectiveness, and accountability. Then we had a field data collection phase involving 25 key informant interviews, 2 focus group discussions with beneficiaries, and 2 group discussions with members of the alliance. And so, in line with the framework, those key informant interviews were, strategic level staff members of the organizations involved in the consortium, people involved at the more kind of technical implementation level, but also external actors, coordinating agencies, people working across other sectors. So that gave us, hopefully quite a holistic view of how the GCA had been doing. And so I guess, okay, before I go into the lessons, just to illustrate a little bit what we learned from this in terms of cash transfers globally, and then I'll talk a bit about the lessons in terms of the use of the framework itself. So the GCA was interested because it was kind of a hybrid model. It was a single provider model contractually, where UNHCR was channeling all of the funds, but it had some aspects of an inclusive consortium-inspired governance structure. It had a steering committee, had a technical working group, and so we found this to be, quite an interesting model where you could get some of the benefits of an inclusive decision-making without some of the high administrative costs that can go with that at times. A clear learning was also around the quality gains from harmonization. So the GCA's main success was that they managed to go from sort of 6 or 7 different agency-specific programs with different features to a unified cash transfer program covering the whole of the target population. And that was, possible partly because they had full funding to cover the whole population, but also, we found linked to the way the model was designed. And so that had obvious effectiveness, accountability benefits, which were not always achieved due to some shortcoming in implementation of some of the frameworks developed, but still an interesting learning. One thing that we learned looking at this as well is around the measurement of cost efficiency. So, I mean, Kristen and Isabel mentioned this. The TCTR is about as standard an indicator as we're going to have to try and compare the efficiency of different delivery models. What we found in the Greece context is that to just take an efficiency ratio like this as a measure of how efficient the delivery model is kind of limiting. because it doesn't consider the context. In this case, they had to do a full registration of all POCs, which meant that they couldn't meet the efficiency ratio, but was in fact maybe a necessary step to achieve some efficiency gains further down the line. And I guess the last major finding we got from the Greece review was around sort of agency roles and added value for CTP at scale. And I think that's, been taken on board and is reflected in some of the new ECHO guidance. But we found that different members of the alliance, UNHCR as a big UN agency with quite strong processes, versus some of the NGOs who had less of a holistic, geographic presence, maybe more of a specialized value added on protection issues, targeting issues, M&E issues, could come together and each bring different value added to the model. And that definitely strengthened the effectiveness of the outcome. So just to wrap up, I guess, because this was the first time we used this version of the framework, it also allowed us to learn a little bit about what it meant to use it. So the first big challenge that we faced, I think Kristen mentioned this, was around the use of the indicators. So the way that we designed the framework was with a view to try and capture some standard indicators that would allow comparison between cases. What we found in Greece is that it's very difficult to capture these indicators due to data availability, to issues around data sharing, and just general comparability of monitoring and evaluation data sets or cost information. So what we thought from this was that, the quantitative elements of the framework are useful to qualify or to provide stronger evidence for some of the qualitative findings. But the framework, does remain primarily qualitative in the approach, unless much more work can be done in individual cases to try and really nail down indicators early on and make sure that the data is going to be available at the time that it's needed. Linked to this, we realized we had issues around timing and sequencing. So agreeing the drivers ahead of time was really important, and that meant that the field data collection and the questionnaires could really be focused on these 8 areas which we thought were most important to look at. But as I said, in terms of indicators, we left that a bit too late, and there was a bit of a sense that could just be agreed in country, whereas it was clear that for this to work, that the data on the indicators needs to be captured ahead of time, and you need to allow plenty of time for that analysis and data sharing. Another thing that we learned is that, so the way that the framework worked was that it looked at contextual factors in relation to specific moments of the project cycle or specific drivers. We thought that in Greece it was important to capture how the context had influenced the model as a whole, and to try and take a bit of a broader, more strategic view of understanding the context and what that means for the formation of different models. And that was reflected, I think, in Kristen's overview of findings to date across cases. The last main learning which I wanted to highlight around the use of the framework, which I guess Ruth will go into more when she talks about next steps, is one of the objectives is to allow comparison between different case studies. And so we thought that the best way to do this would be to have standard indicators that we could compare, like efficiency ratios. So if we knew that 80% of funding was going to beneficiaries with certain models and it was a lower percentage with other models, that would give us quite a good indication of the relative efficiency of different models. What we found through piloting the framework is that this is possibly not the best way to do comparisons, because it means that the contextual differences are not always well reflected. And so what we proposed following this pilot was an approach which looked more at the learnings from different cases and how these learnings could be tested against other case studies that would take place. For example, around the value, the efficiency gains from a shared financial service provider, where we can look across the different case studies that have been done as to whether that assumed efficiency gain actually does actualize. And we don't necessarily need to quantify that with a standard indicator. I'll leave it at that, but I'm happy to answer sort of any questions. And I'll pass it to Ruth on next steps.
Okay, thanks very much, Robin, and Kristen and Isabel for the presentations. Initially, we were going to do a Q&A and then go on to the next steps and then do another Q&A, but as we've overrun slightly, I'm just going to quickly skip through some of our thinking around next steps, and then we can just open up to discussion. So, I mean, obviously, we're very much aware with this as well that the work that's been done on the operational models framework, and the work that Cal's been leading is just one part of a much broader range of work that's being undertaken on this topic across the community of practice. So obviously when we're talking about next steps here, it's partly things that we want to do specifically with this framework, but obviously a lot of this is about how we can really draw in and draw together all the various pieces of work that are ongoing that are going to have a lot of synergies with each other as well. And we'll come back to that in a second, but with the framework itself, and obviously the first step, and this is part of it that we're doing now, is to disseminate the framework itself and the case studies that have been compiled to date. So this is one way of launching, and that we'll be looking at other ways to kind of reach out and ensure that those can be kind of seen and used as broadly as possible. A key thing that Kristen was talking about as well, obviously, is about how we can collate the evidence base that has been generated and find the ways to kind of be able to tailor the findings that are emerging from that and disseminate those, so that they are useful to the various different audience groups that are out there in the community of practice to help inform their thinking. So we're still looking at the moment at some of the kind of most effective ways of doing that, and that's something as CALP that we would see as kind of a role that we can undertake going forward, is obviously continuing to keep abreast of new developments and to continue to collate that evidence base and share it. Something else we would obviously like to do for anyone out there that is interested in using the operational models framework kind of in part or in its entirety, that we can support them in terms of providing some technical advice and guidance on how it's been used to date and how it might be adapted to the work that they're doing. I think the slide has disappeared now. I can only see the chat box. Don't know if it's possible.
I think that's only for you. I'm very sorry. I'm trying to restore our chat box for everyone and having some slight technical issues. Ruth, I think people can still see the slide. Sorry about that.
Okay. All right, sorry, that's okay. And then so briefly, I mean, the other thing that we obviously want to do, and obviously Kristen has explained that this framework has already been through various iterations, but we're not seeing it as that's it now, it's a static product, it will go out into the world and we'll leave it as it is, that we want to continue to gather feedback on that framework so we can review and revise it, and that is going to include as a really important component kind of the analysis of what this will be used for and by whom, and what their needs are. So this kind of comes back obviously to the framing questions that we were asking at the start, because this framework obviously and adaptations thereof are only as useful as they can be when they're really responding to needs. So part of this process now is really to kind of go on and with the community practice, with our members and others to really identify that. And then the fifth point there, and this was kind of looking at what are the other needs that can kind of be developed perhaps off the learning that's already been generated. One of the things that has been highlighted as a need is to develop guidance to inform practical decision making on operational models at the various stages in the cycle. And we know, for example, that the collaborative cash delivery platform is also really looking at this, and so that's an area where perhaps we can look at how we can work together to draw learning from the framework and adaptations to help inform that process as well. Okay, so I'm going to leave it there, but really at this stage we want to open the floor, and I know either through the chat box or if you want to ask a question directly and you've got your microphone enabled, which you can do by clicking on the top bar, then please do let us know. And we've also got on the top bar there's a hands up symbol, which can be useful to kind of order questions if we get a few. So if you want to ask a question, you can try clicking on the hands up, and then we can invite people to speak. Okay, so everyone rushing at once.
I'll jump in with a question. Hello. Can you hear me?
Hello. Yes,
Hi.
yes, can you?
Yeah, this is Steph from Oxfam. Just a question about, please correct me if I've misunderstood, but it sounds like the sort of cost efficiency and effectiveness wasn't necessarily assumed in some of these models, but only really made sense over longer time periods. And I'm just wondering whether any of that has been fed back to donors, given the shift to more collaborative single delivery models, and whether or not any of the donors have any feedback or comments on that. Because I think the cost efficiency was one of the sort of drivers for that shift originally into single delivery.
Okay. So I don't think, and I think, well, Isabel, Kristen, and Robin may have a clear idea on this, obviously from being more deeply involved in the development, that any of this learning has been formally fed back to donors beyond obviously the fact that the case studies and those findings are out there at this stage. But this is one of the, obviously, the elements that we're discussing here, as well as kind of in terms of what is a big information need and how can that be well communicated, drawing on the learning from this. So certainly in terms of those kind of communications tools as well and how that can be used for advocacy, that's definitely something that we want to consider as we go on. I don't know if anyone else has anything else to add there.
Yeah, it would be great to hear you all. What are the types of discussions that you're having with donors when you're designing models, when you're seeking funding, and what are what type of evidence would you like at your disposal to be able to inform those discussions and advocate effectively? That would be really helpful to understand.
I think. Hello?
Yes, can you hear me? This is Balletta speaking.
Yes, we can hear you. Please go ahead.
Yeah, all right. Just a couple of actually maybe question. I think the whole maybe it is a very good presentation. I think the experience is good in terms of documenting and some of the learning and from different models that will potentially inform future selection of actual operational models. So I think one of the things that we have been also looking at or discussing is that who, say for example on the single agency arrangements, if an agency is doing humanitarian accountability, who is actually going to evaluate the how functional, how effective, efficient, or the quality of that system in the whole data arrangement. So I think that's basically, it's not clear yet. We have one agency involved in monitoring, another agency on the payment, maybe another agency on humanitarian accountability. I think those are kind of using any tools and of course available tools. Who can actually do that? Is it should be driven by consensus? Should be driven by donors? I think those are kind of things that that need some kind of reflection. So I think that's what I can say. If you can reflect on that, that would be good.
Okay, thanks, Bertha. It was a little difficult to hear everything, but I think it was broadly you asking the question of, who it is that would have the responsibility for kind of assessing, evaluating the effectiveness, efficiency, and accountability of these various models.
Yes.
Yes. Sure, and I think that absolutely is not an answered question at this stage. There have obviously been some kind of interesting developments in that regard, and so you've got something like the Chameleon consortium that's now been set up in Lebanon as a kind of independent third-party monitoring of the WFP cash delivery program there, and that includes a kind of a wider program of research that will be looking at elements such as accountability and value for money. So that, I think, is one approach, and it's a broader one to answer. And I think some of the questions that were posed in the workshop that USAID and IRC recently hosted in Washington on cost efficiency and cost effectiveness analysis in particular, and the kind of the capacities and resourcing that are required for that, and that to be able to do that systematically does require in itself a kind of specific resourcing that really would fall to the donors to be bringing in. And again, whether or not that's something that organisations would be undertaking internally, or if it's something perhaps that could be undertaken by an external body. And I think these are still questions to answer. I'll leave it there. If anyone else has anything to add on that, please do jump in. And I see, so Isabel has responded in text to the earlier question Henk had on the technical support that we can provide within CALP.
Yeah, I can also highlight while Isabel's responding to all the questions on the chat box that all of these studies are or will be shortly available.
Yeah, in fact, so they are all now available through the CALP site. I can post some of the links now.
I've just done. Are there any? It would be great to hear from anyone who is using perhaps different methodologies or similar methodologies to build evidence on existing operational models in different contexts. Does anyone have anything to share on that front?
And again, I mean, if they don't have anything to share immediately, but if anyone is aware of anything else that they have coming up in terms of relevant initiatives linked to operational models that they would like to discuss, then you can also get in touch with us via email. I'll just put this in here. And then obviously we can follow up one-to-one. So I don't know, are there any other questions? I'm not sure. Have we answered all the questions in the chat box? Okay, that is a tough question. I don't know from the studies that have been undertaken, so the question that Katharina's just put here, are there any relevant reflections from studies that people have been involved in? I'm not sure if this is something that's been touched on there.
Just, I'll check something and then Kristen, please do add. I think that as a starting point, we're assuming that as part of the feasibility assessment and design of the programs that we're evaluating or that we're assessing, that a delivery mechanism that's appropriate for the benefit that matches the beneficiary preferences has been selected. Now, finding the balance between that and scale is not always easy, and we know that in some contexts, whilst in the Middle East there might be a range of different mechanisms that are scalable and that are accessible even in sort of relatively remote areas, that's not the case in other parts of the world. And I think that's partly why we're a bit concerned about the push towards the idea of one single delivery system, when we know that's not even feasible everywhere, and let alone appropriate for beneficiaries. And so I think that's why the learning that Kristin highlighted on the fact that sometimes it's not necessarily more cost efficient to have a single delivery mechanism, and that actually cost efficiency and effectiveness and accountability gains can really take place at other stages of the program cycle. Hopefully that means we're sort of moving the discussion away from solely focusing on the delivery part. And then by introducing the accountability component into the framework, then that addresses the types of questions that the points that you've raised there as well, Katharina.
And I think this also links to the question in the chat box from Chiumba Mataya, sorry I can't say names very well, around interest in understanding whether single cash delivery agents for large programs takes away some of the gains that you would have in a competitive process when you have lots of cash agencies. So I think that the use of the framework starts to look at the opportunity cost, or let's say, so what if we hadn't gone with a consortium model or with a large-scale operational model? What are the other opportunities that we missed by choosing an operational model? So I don't think we have an answer on that, but I think that by using this framework and by thinking about models in a sort of standardized way, or at least capturing learning in a standardized way, that we can begin to look at these questions that are raised in this chat box more. And that also links to what James is saying around efficiency, effectiveness, and relating to program outcomes, or it's just the output level. And that's been really difficult for us, and same with IRC's work, I know, as well, and with the workshop that was mentioned in Washington. It a lot depends on at what point we capture the data, as Robin mentioned, I mean, if the programs are ongoing or later, and what data is available, and how we look at that against the inputs that have been put into place. So I think it's not an answer yet, but more that we're hoping the framework can inform answers and start to generate learning around these kinds of questions.
Okay. We've probably got time for one more question, if anyone has anything that they want to ask. It's just saying she missed the answer to James's question above. So I think Kristin's just referred to it.
Yeah, I wouldn't say we have an answer. James asked whether efficiency and effectiveness has been measured related to the outcomes or just at the output level. And if we stop at cash to delivery, or do we go on to look at how sectoral needs have been addressed? And I think those of us who have been involved with cash discussions for a while can agree that this is sort of the next conversation that cash is taking, and how do we look at sectoral outcomes in terms of cash, and how does that relate to the work sectors are leading in their role in monitoring outcomes, as well as integrating that into cash monitoring. But that would be, I think, separate than the conversation around this operational models framework, which could inform this question, which is the core question around efficiency and effectiveness at the output level or at the outcome level. And as Robin's study showed, it kind of depends on when you do the data analysis and when you do the study or use the framework, and what data is available to you. So in theory, you could use this framework to look at the more outcome level, but it again depends on what point in time you decide to use this framework and what's available to you in terms of data and information to be able to use it. And I think it can also be expanded in the future as those discussions around sectoral outcomes and related to cash take shape in the coming year or so, if that helps.
Can I just add a word on this? I mean, I think the way that the framework is built is that for efficiency, it will look at output, so it's just the cost of transferring the cash. But for effectiveness, there is scope. I mean, as Kristen mentioned in her presentation, there is scope to use the framework flexibly, and there are suggested indicators and indicators that can be added that would look at outcomes depending on the outcomes of the program. I mean, if the program is a multi-sectoral cash program, you would look at multi-sectoral outcomes. If it was sector specific, you could still use the framework to do this. It's just linked to the objectives you're trying to achieve, and then you would build on.
Okay, so we've got one last question. I think we will probably have to draw to a close there, because I know at least one or two of the presenters need to head off. So the question is, can a single delivery model be used for multi-purpose cash projects, and how will the effectiveness be measured across sectors? So I mean, I think yes, it can be used to deliver multi-purpose cash. That's probably the more simple part of it. The question about effectiveness being measured across sectors, I think, is very much an ongoing discussion at the moment, because there isn't a standardized way of monitoring outcomes on a multi-sectoral basis. So there are different ways that have been posited, and obviously ways that are being used. Some of those are looking at using sector-specific indicators and looking at those on a composite basis. And then, of course, there's other approaches being used where you're using indices, sort of coping strategy index type, or similar expanded versions thereof that are looking more at kind of ability to cope and well-being on a more general basis, and or they may be using, a combination of sectoral indicators with an indice as well. So, and USAID at the moment has been leading a piece of work to collate the various sorts of indicators that agencies are using to monitor multi-purpose cash at this stage, and they're looking at then how, because this kind of generated, I think, over 100 indicators, so obviously far more than you could possibly use as a standard, but then how we can to go on to narrow those down and perhaps try and identify, a standard range that would be used on a cross-agency basis. Obviously much easier said than done in that case. Okay. So I think that is going to be all we've got time for. We're going to have to wrap up then. But I'd like to say, obviously, a massive thanks to all of the presenters and to all of you that have joined us today. So do please keep in touch on this topic. We'll be looking again at how we can kind of disseminate more on the learning to date, and we'll be, I think, also setting up or re-establishing the working group on operational models to see how we could try and take some of this forward internally. So, thanks very much, everyone. Have a great day, and keep in touch.